welcome back to the Love is Healing podcast. I'm your host, Magnolia Heaton. I'm a licensed clinical social worker, and if you'd like more details on my qualifications, they're down in the show notes. This is a people's podcast. We are here to bring information to the people. We discuss sex addiction, multiple addictions, eating disorders, frequency medicine, functional medicine, trauma, and really the intention is to bring learning and information to you to give you different perspectives so you can live a fuller life. Thank you for joining us today. Today we have our guest, Amber Bowers. She is a holistic mental health counselor, integrative health coach, certified neuro-emotional technique practitioner, and eating disorder specialist based in Chardon, Ohio. She works with clients both in person and virtually worldwide, offering deep, transformative support for those who have done it all and still feel stuck. Amber takes a whole person approach, integrating mind, body, and spirit through modalities like internal family systems, NET, contact reflex analysis, the Lebowitz protocol, and other integrative tools to uncover the root causes of emotional and physical symptoms. Her work is shaped not only by her personal healing journey through chronic fatigue and misdiagnosis, but also by her experience working in the community mental health and higher levels of care, including inpatient psychiatry and residential treatment. Today, she helps clients connect the dots between their nervous system, emotional patterns, and physical symptoms so they can finally experience real, lasting change. Thank you so much for being here today, Amber.
Thank you for having me.
Of course, you're welcome. I always speak too soon there.
That's okay.
It happens. Thank you. So, you're here today to talk a little bit about your journey. There's a lot that you have learned. Clearly, you have a lot of qualifications. You have a reputation within these healing spaces to be a super effective practitioner, and you're really good at healing healers and professionals, high-level professionals at that. But it all wasn't always this way, right? Tell us a little bit about your journey and what led you into these holistic spaces.
So there was a lot that led me in this direction. And I want to share too, I came from a more traditional background when it comes to medicine and how I was treated growing up and how I approached things. When I was in high school, I think I was 15, I got diagnosed with mono. Very much like the type of kid, perfectionistic, tried to miss as little school as possible when I had mono. And went back to school. And I remember prior to having mono, I would wake up no problem, never had any issues with feeling rested. And after mono, still to this day, I have not woken up feeling rested. And it's kind of fluctuated over the years in terms of my fatigue, where from high school to college, continued to complain about feeling tired. And my providers at the time, I honestly don't think they even did lab work. They misdiagnosed me with depression, which at the time I didn't understand, but then going through school, doing psychology, getting my clinical mental health counseling degree, I have a much better understanding now to recognize that they truly did misdiagnose me. They put me on antidepressants that did absolutely nothing. I then was training for a half marathon my freshman year of college. And in my notes, still, you can look up in my chart, my provider noted that I said, feels like I could run further. I was running 7 miles at that point. Felt like I could run further, but couldn't catch my breath. And then got diagnosed with athletic induced asthma, which I now know was actually air hunger, which many people are familiar with, that being more of a symptom of Lyme disease. And from there continued, went off the antidepressants because they weren't doing anything, continued to just kind of push through that fatigue, feeling so tired all the time until I think it was end of undergrad, beginning of my graduate program. And I was so tired. I was driving an hour to and from work every day, getting enough sleep, but feeling like I was falling asleep when I was driving, like literally physically holding my eyes open, rolling my window down, doing everything I could to stay awake while I was driving. Went to my doctor again, and she referred me for a sleep study. So I did an overnight sleep study. Then everything was fine. Did a all day sleep study where you go in after a full night of sleep and you take 5 naps separated by 2 hours each. I fell asleep in every single nap, and it took me an average of 5 minutes to fall asleep. And they called me with my results, and word for word go, well, we got your results and you are very sleepy. Shocker. Didn't need to hear that. I already told you that. And then proceeded to put me on stimulants. And so I was 1 nap away from getting diagnosed with narcolepsy. If I would have gone into REM sleep in another nap, I would have gotten diagnosed with narcolepsy. But they diagnosed me with idiopathic hypersomnia, which essentially means you're very tired and we don't know why. And then they just prescribed stimulants. And so that was, over 10 years ago now. And so going through over the years, I've had times of trying to figure out what's going on, other times where I've just felt helpless, thrown in the towel, times where I felt very depressed because of being so tired and being so fatigued and feeling like I couldn't function and show up in life in the way that I wanted to. Now, alongside that, I was also working towards my counseling license. I began working in the field. I worked in community mental health and then transitioned to working in inpatient psychiatry with active duty military, and then to working with eating disorders and inpatient and residential. And I, through all of that, had also seen how often I felt like the system was failing our clients and seeing them rotate through, seeing them get readmitted. I mean, even just some of the stats on how many treatment stays someone requires to achieve recovery for an eating disorder, it's astronomical. Like, it's just not something that I feel is something we should accept as an answer. And so I finally dug back into things. It was after COVID. During COVID, I was pregnant with my son, and I started being more mindful of things, getting into the more holistic space. And I went through a whole year of functional medicine. They ran a bunch of labs, did stool tests, elimination diets, all the things, put me on a bunch of supplements. I was a year in with that, and I started smelling ammonia when I was running. I was feeling worse. Nothing had improved from my perspective. And so I did a deep dive. I found Dr. Charlie, which I know you've talked about him on the podcast before. So I saw his membership. The first video is on releasing emotional trauma. He talks about NET, shares a lot about the different approaches that he uses. And so I did a deep dive. I found a provider that uses that. And now I'm couple of years in doing those different modalities for myself and also getting trained in those to use those with my clients and seeing a world of difference. Although I haven't woken up feeling rested still, I am at such a different place now than I used to be even 2, 3 years ago, where I couldn't tell you the last time I was driving and couldn't keep my eyes open, or the last time that I was yawning during all my sessions because I was exhausted and feeling like I was going to fall asleep. And so I've seen the progress that has helped me make, and also seeing the huge impact that it has had on my clients being able to use these different approaches.
Thank you. That is quite a journey.
Mm-hmm. Yeah.
Wow. Okay. Before we talk a little bit more about that, can you explain for the audience what air hunger is? Because some people might not know that they have it.
Yeah. So, once I read that in my chart too, because it was something that I didn't even recall having as a symptom at the time. But then once I read it, I was like, yeah, I was also the person who, like, I struggled to catch my breath. I couldn't read a full sentence without feeling like I couldn't breathe. Like, even in school, like reading out loud, I always just thought it was my anxiety. And sometimes it can be. However, it's very clear, like even for me now when I have flares and I'm like reading a book to my kids, I can tell I have a harder time getting through sentences without feeling like I can't catch my breath. Like it's almost like a suffocating feeling. And now to understand too how much of that was also contributing to symptoms of anxiety that I was experiencing. So, yeah, that's how I experienced it.
Thank you. And then were you diagnosed with Lyme officially, or is it just other things pointing to that?
Yeah, I have not been diagnosed with Lyme. And I'm always, I come from the perspective of I'm really not big on diagnosing. I don't diagnose my clients. I feel like sometimes there can be this um, like over identification with diagnoses, and that can sometimes cause harm. Lyme has shown up in frequency testing for me. Mono has continued to show up in frequency testing for me, and that is something that I know has impacted me. But I'm just not one to like harp on, oh, I have to go get a lab test to prove that it was in my system.
Absolutely. Thank you for that. Now, with all these symptoms, clearly there's a lot going on. It's a really complex picture. There was a lack of answers. Now, for the audience, there's a difference between lab testing and energetic bio testing. Of course, lab testing is what you typically have when you go to a typical doctor, and they might or might not order the actual lab test that you're asking for because insurance might or might not pay for it. So that's a barrier. And then also there's a barrier in reading the actual tests, interpreting the data, right? And so we have the lab test, and there's the concept also of energetic vial testing, which is something that you're familiar with now through the Lebowitz technique, which we'll talk about a bit. And so you're understanding now, based off of the information that you have, because you've taken a lot of trainings in the frequency medicine world, functional medicine, these kinds of spaces, it seems that EBV essentially is mono, and that tends to co occur with Lyme, right? And then you're looking
Mhm.
back and reflecting on, oh, I grew up in New York and I was outside a lot. And yeah, it's very likely that I was exposed to something and contracted Lyme that way. And tell us about that story about you had a provider who wouldn't test you for Lyme.
Mhm. So looking back, I now suspect that I had Lyme and mono at the same time. I was not tested for Lyme because I grew up, born and raised in Ohio. And we had property in New York where, like in rural New York, where we would go ride four-wheelers. We were in the long grass, like spending lots of time in the woods. And my provider more recently, I had asked her to run labs for Lyme and she refused. And then I told her that we spent a lot of time in New York and she went ahead and then ordered the Lyme because historically, Ohio has not been what I guess medically they consider a higher risk for Lyme in terms of getting infected. And so she wouldn't run the test until I told her that we grew up in going to New York and spending time there in the woods. And so then she ran the test, and I actually had a functional medicine provider at the same time who also told me there was another test she wanted to run for Lyme, and this was all through insurance. So, and she told me literally word for word, they won't let me. And I was like, well, what do you mean they won't let? So, because it wasn't something that insurance approved of them running, even though she suspected and wanted to run those tests, she was not able to. And then at that point, I didn't see the point in spending the money to get a lab test done. I had then been, not long after that, started working with a practitioner who uses applied kinesiology and the Lebowitz technique and CRA and a number of other techniques where she was able to show me that co-infections for Lyme showed up in the frequency testing, EBV showed up in the frequency testing, which we also know is going to be more accurate than most lab tests anyways when it comes to it's testing that frequency oftentimes before symptoms even show up, whereas blood tests can only show so much. Frequency can get a lot more specific with that.
Yes. And with the Lebowitz technique in particular, they call it
Yep.
non-diagnostic energetic vital testing. It's a mouthful. But yeah, like they don't necessarily diagnose things, but essentially, can you explain a little bit about that? Yeah, like, yeah, what Lebowitz technique is.
Yeah, so there's a number of different vials that we use that test for heavy metals, for hormones, for food sensitivities, different um, bacteria, viruses. So there are a plethora of things that we can test that the vials have the frequency of whatever they're testing in it. And so the idea is when you put that frequency into the energetic field of the person, then we see whether or not it strengthens or weakens the nervous system. So, and again, back to the diagnosing piece, like we're not using that to diagnose. And I think that at that point, it's not even helpful, right? It's like we're just using it as data of, okay, what is weakening your immune system or what is weakening your nervous system? And then what do we need to supplement to help support that?
Exactly. So essentially, there's the person is set up in a way so that their body can recognize any threats, anything that's going to weaken the person. And then you gather all that together and then you figure out what the remedy is for that. So they have their own product line, Supreme Nutrition products, and that does the job for the most part. But they also do test other things depending on the practitioner and what they're aware of, product lines that they work with. And yeah, it's a lot of herb work. What you've done that, right? And then you've also done some CBT, right? What is that?
Mhm. So I'll just walk you through kind of what helped me on this journey and what order my chiropractor took, because I think it'll help people to understand too, like first we had to focus on the foundation. So first we're looking at using more of quantum neurology, making sure that my nervous system was in a place where I was going to be able to respond appropriately to some of these supplements and some of the things that my body was needing. And so we did that. The next thing that we did was the Lebowitz protocol, which also helped to find the EBV and know that that was a huge piece of it. And my provider uses a technique called CBT or Craniobiotic Technique. So this is a chiropractic technique where they use a magnet on top of your head and then they put a glove on. They use the back of their hand to test different reflex points and be able to basically pull out the virus. And so your body is aware of it. So then your body can fight it. And so personally, I think CBT actually has been one of the most helpful things for me physically. Anytime that I have a flare, we do CBT. I tend to be more tired that day, although more recently I've had a flare and I did a hyperbaric oxygen chamber the same day and I felt really good. But it's something that definitely helps to kind of like speed up that process so that it's not just continuing to linger in your body.
Thank you. And I know that you were having a lot of histamine issues as well. Can you explain what those are, what that looked like for you, how they're progressing these days?
Yeah. So histamine issues, I think, vary a lot from person to person. A lot of times when people think histamine, they think congestion, they think more like allergy response. For me, my histamine is a lot more of skin issues, motion sickness, heat sensitivity tends to be like breaking out in heat rash, sensitivity to the sun, things like that. And very much gut related. So there's a lot that I've had to do working on like SIBO and fungus to be able to address some of the histamine issues.
Yes, and for the audience, SIBO is small intestinal bacterial overgrowth, which means so we have bugs in our gut, and that's fine, and it should be that way, and they should be helpers. They help us to digest things. Actually, most of our DNA is that and isn't our own, FYI, which is an interesting fact. And so bacteria and parasites are what the bacterial overgrowth are. They're harmful to us. And it's just, I mean, we need some of the bad ones too, but it's extra and it harms us. Causes issues, can lead to inflammation issues, immune disease, a lot of mental health issues as well. And then you have the SIFO, which is small intestinal fungal overgrowth, which is mold, yeast. I love gut stuff. And yeah. Anyway.
Mhm.
So yeah, it makes a really big impact. I know they talk a lot about the gut brain connection.
Mhm.
That's something that's starting to become more common, but it's a bidirectional relationship. So it's the brain's talking to the gut is also talking back to the brain. And if there's inflammation in one, there's inflammation in the other. The mouth is something else that's really tied to the gut. Because if you have inflammation in your gums, bacteria here, it's going to go down into your intestinal tract, which is going to be connecting with your brain. Then there's this other component, which is the heart. It's also really connected to the brain. And turns out that the heart actually connects way more to the brain than the brain does to the heart. So interesting stuff. We're going to talk a little bit more about the emotional and metaphysical aspects of the healing piece, though, before we go into that. Can you talk a little bit about contact reflex analysis?
Mhm. Yeah, so contact reflex analysis is another technique that my chiropractor uses to help treat me and help get me to where I'm at right now. But it is a chiropractic technique that goes off the triad of health. So we're looking at what the person is needing structurally, emotionally, nutritionally, which then helps us to understand and prioritize what is needed, and then creating a protocol for the person based on that. So the way that I use it in my approach might look a little bit different than the way that a chiropractor is using it, but because I tend to look more at the emotional and collaborate with other providers, whether they be functional medicine or chiropractors, typically what I'll do is I'll test, like, structurally will be techniques, technologies, whether they're mine or they're techniques and technologies that someone I'm collaborating with is using. So like if I'm seeing them and they're also being seen by a chiropractor, or see if they need the Lebowitz technique, they need acupuncture, like what techniques, technologies, red light, um, hyperbaric chamber, all of those things. Emotionally, then that's where I pull out my menu of things of, do they need NET? Do they need CEW, which we can get into? Do they need flower essence? Do they need essential oils, homeopathy, and then nutritional, again, essential oils, homeopathy, and then more of the supplements to help support.
Wonderful. Thank you for that. And a little plug here. We do have 2 episodes already on the triad of health and on chiropractic. My recommendation would be to go back and look at episode 7. That talks a little bit more about the pure chiropractic approach and technique. And then we have a little bit of an integrative episode, which talks a little bit about chiropractic and neuroemotional technique and all these other techniques as well. And we touch on Lebowitz. And that is episode 9. And that is another episode with another chiropractor. And yeah, contact reflex analysis, the way that I look at it is I'm a really heart centered person, clearly. I mean, the logo for this is heart, and it's the Love is Healing podcast. So, one thing that I really like that they teach in contact reflex analysis is that the heart is the queen bee, which I wholeheartedly agree with that. This is more of a functional perspective, a root cause perspective of like the philosophy goes that the heart is the main organ in the body and the whole body will sacrifice itself in service to the heart. So then, as we transition into the trauma and the emotional pieces of things, this is a good segue with the heart. I mean, it should be strong and pumping and things like that. But things aren't so simple. It's like in social work, we have the biopsychosocial spiritual lens, right? So biologically, the heart is the heart, but it is also an emotional organ and it is also a spiritual organ. And when you experience any heartbreak, trauma, that's going to have an impact on how your heart functions energetically, physically, metaphysically, and emotionally, actually. And so then you can have intellectualization. So your brain's taking over, you're an overthinker, you have a lot of anxiety, things like that, even OCD, right? So this is just to get the audience thinking about how everything is interconnected. Now, tell us a little bit about the emotional part of your healing, Amber, and the metaphysical components of your healing journey.
So for me, I pretty quickly learned that my fatigue was not all physical. And there were a number of other things contributing to that, which I think from an outsider perspective, I think anyone could have looked at me and told me that. And from my perspective, it was something that I avoided. I thought I was just pushing through, doing good, right? Like reality, I was white knuckling it. I had no understanding of my energy in general, how to protect my energy, and especially doing some of the work that I've done in the past with working in inpatient psych, working with some really challenging populations. Um, I just gave and gave and gave. I gave my energy to everyone else. I did so much to try to help others that I was really neglecting myself and neglecting my energy. And so I've done a lot of work when it comes to NET on being okay having energy, being okay protecting my energy. A lot of times energy can correlate to boundaries for people. So being more mindful of, my boundaries with work, not bringing work home with me, my boundaries with, coworkers and friends and family, and just making sure that I was honoring myself and honoring my energy and protecting that and taking care of it in the way that I would want my clients to. And then the metaphysical piece, I think, comes in a lot with, again, that energy, like people taking my energy, giving my energy away. It just like how we're impacted by the energy of the places that we're in. For anyone who's been in a hospital or been on an inpatient psych unit, it's not a pleasant place to be for anyone. There's white walls, there's no nature, you're so disconnected from everything that we're supposed to be connected to. And it can be a really hard place to be in. So, like day in, day out, working in that setting can really take a toll on people.
And I mean, entities exist and dark energies exist, and that's a whole other rabbit hole, but I'll just leave that there.
Mm-hmm.
Yeah.
Yeah.
Have you, with NET, experienced any major physical healing?
My favorite story to tell is my first experience with NET, which was up on stage at a basic seminar. And I had pain in my foot that started during my pregnancy with my twins and then didn't go away. And initially I was like, well, I'm pregnant with twins. Of course my feet hurt. And then like 2 years in, I'm like, okay, why does my foot still hurt? I think a year in, I got an x-ray and there was nothing, like it was perfectly fine, nothing structurally wrong with my foot. And so then I went up for a demo and I'm thinking, body entry, like what's the worst that could come up? It's just something with a pain in my foot. And I go up and it initially goes back to, I want to say it was like feeling less than as a woman is what the initial concept was. And that came back to, we test conception to present day to see if there's anything comes up. Well, nothing came up conception to present day. And so then we tested preconception and he asked me, what are your beliefs on where we are before we come here? And did some test statements on me. And so he ran through different statements, I exist in the past, I exist in the future. And then he had me say, when I was born, I lost my existence. My arm fell down, I broke into tears, and it was the most bizarre feeling. It felt like I had been carrying this weight with me my whole life and never had words to describe what it was. And it felt like in that moment, everything just made so much sense. Like I finally had an understanding for why I had been carrying that weight all this time. And then, I joked my foot didn't feel any different when I walked off stage. I felt very different. I felt very neutral. And I'm the type of person like doesn't like being on stage. that was a lot for me to be crying in front of a group of 70 people. Walk off stage, and then I went up to the chiropractor that had been working on me later, and I was like joking around, so you're gonna finish fixing my foot or what? He did another session of NET on it, and it went back to my pregnancy with my twins. And he looked at me and he said, "Were your babies breech?" And I was like, all my babies were breech. Why? So my first and the twins were all breech. And he said, "This is the acupuncture point for turning a breech baby. Your babies knew that you weren't ready for them to enter this world." And I have not had foot pain since that day. And I wholeheartedly believe that, right? Like my first was born in COVID, and we definitely weren't ready for the twins. And so now, I've worked with clients on, um, a lot with NET on baby in the womb, NET on women who are pregnant, preparing them for labor and delivery. And I wholeheartedly believe that had I addressed emotions during those pregnancies, they would have flipped and they wouldn't have been breech because there wasn't anything else physically preventing them from flipping.
That's another example of how the body really keeps the score, and the body has a lot of an innate intelligence,
Mm-hmm.
and how babies are so
Absolutely.
and how babies are so connected to us.
Yeah. Yeah.
And as we're starting to talk about the spiritual component of things, where we are before we're born, etc. What can you share about any metaphysical healing that you've experienced along your healing journey?
Actually what got me, aside from some of my own work doing metaphysical, was some metaphysical things that have come up with our son. And so um some of the most like powerful experiences that we've had with that is, I think he was 4, might have just turned 5. I can't remember exactly how old he was, but he just all of a sudden, like, behavior had changed. He was a lot more moody, crying at bedtime, like hysterically crying at bedtime, telling us that there was monsters in his room. Um and so we met with someone who did some metaphysical work with him, and what happened was they did find entities in his room. Um, ironically, but also not. Like, he was able to give the number of entities, and that person confirmed that it was exactly how many he thought and felt and saw. He's someone who's very spiritually sensitive, and he can see those things. And so knowing just how much that has impacted him, like, we cleared the entities, we taught him how to protect his energy, we taught him that, yes, they may seem scary, but ultimately, like, he has the power and we have more power, that they have to listen to us. If he tells them to leave, they have to listen to him. And so he learned to protect himself. Funnily enough, though, then it was like a couple months later, and his behavior started shifting again. And I was like, "Hey, bud, like, are you still seeing monsters? Like, are there any monsters in your room?" And he was like, "Yeah, but they don't bother me anymore. I like them." And so then we had to have a conversation of like, okay, like, I understand you might not be afraid of them anymore. And like, let's pay attention to how they're making us feel, how they're causing us to behave, how they're impacting our emotions. Because even though we might not be afraid of them, they still might not be good to keep around. And so it's just been so fascinating, I think, to see the direct impact that it has had on him. Um, because it's like night and day. Like, we clear the entities and we're back to baseline. Things are good. And that's happened like even more so now with, all 3 of my kids. Of if energy feels really off in our house, usually there's something that needs to be cleared, or there's something that's happening. I've seen it with working on clients, just working on with a client the other day, and their dog wouldn't stop barking and was super anxious, and there was entities in the house, right? Like, animals tend to be more sensitive to those things too. And so just being more aware of, how the energy around us can impact us. And even if you can't see those things, even if you can't necessarily feel it, just having that awareness of, okay, if you get a gut instinct that tells you like something is off here or something is off with this person that I'm interacting with, like if you're getting some sort of, you know, signs that things are negative in any sense, knowing that we have the ability to protect ourselves from that and to cleanse our space and our energy, and also knowing that those things can impact our mood. You know, they can contribute to irritability, they can contribute to feeling more negative, being in a negative headspace.
Yes, thank you. To backtrack, because I really want to highlight this component. Historically, I know for sure when I was growing up, people wouldn't take kids seriously if they were saying that there were monsters. And like, I get it. Are monsters real? Depends how you define a monster. Let's put it that way.
Hmm.
But it is important. So when I first graduated out of grad school and had my first job, I worked with kids. And one of the things that my clinical director, who was my supervisor at the time, told me to do was that if I was working with any little kids who were like 5 years old or, you know, within that realm, that talked about having monsters or seeing monsters, that I could make a monster spray for them. So just have a spray bottle, put water in it if you want, label it, call it monster spray, and then they could use it. Because that's like a tool for them to, even through their mind, right, be able to have some sense of power over what's
Hmm.
happening. But then learning more about the metaphysical side of things, right? People's third eyes are really open. People are really energetically sensitive. And I don't care whether you're religious or not, or whether you identify as spiritual or not. The fact is that these things actually exist, whether people want them to or not. It is important to take your kids' words seriously and to validate them. And let's say there aren't even any monsters, and let's say that they are doing it for attention. Okay, why are they seeking attention? And if they're asking for
Hmm.
attention, it's because they need it. So let's give them that attention. Better you as a parent than some kind of harmful person.
Hmm. Yeah. Well, and I will say too, it makes a huge difference even with the monster spray. So we've actually done that too. And there are also different like flower essence sprays that I'll use because I think sometimes, like for me, it's a lot more about the intention. So yeah, it literally could just be water in a bottle. And if your intention is that that's going to rid any negative energy, it's going to help you do that. And I think sometimes people do need something that feels more tangible. And especially for little kids, like it can help to have that tangible piece of like, oh, like almost like this is my tool. This is my like, this helps me like be more powerful against them and like keep them away. Um, but it really does help. I mean, it really can, and that's a way to, again, you don't necessarily have to like be like, oh yes, I see them too, right? But there's a big difference between empowering them and teaching them that they can protect their energy and telling them, no, there's not any monsters. See, there's nothing there, right? Like for them, it feels very real. And you may have a child who is spiritually sensitive. You know, this always takes me back too of like, gosh, my days working in inpatient psych and like we had our like high acuity unit where oftentimes clients were struggling with hallucinations, psychosis, like even how that could potentially impact clients in that setting. Like it's just wild to think about now from this perspective with the knowledge and tools that I have, you know, how much are we actually neglecting them by not recognizing that some of the things that they might be seeing or hearing could very well be real. Just because we can't see it or hear it ourselves doesn't mean that it doesn't exist. And I think that's what this whole world opens us up to, right? This whole world of energy healing and all of the different modalities and things that we use.
Yes. Touching on another piece of what you said earlier, when something feels off with people, what's actually happening is that the gut is responding to things. There's something called quorum sensing. And so that's a survival mechanism that we have where our gut bacteria help us sense danger before our brain can rationally pick up on it, which is when we have those reflexes to like flee or fight, etc. Very important to pay attention to that. Energetic vampirism exists, energetic harvesting exists. those are other rabbit holes as well. Yeah, it can be harmful. I mean, curses and hexes, that happens. I've seen it happen. I primarily practice in New Mexico, and it's a thing, and people proudly do it. So
Hmm.
important to be
Yeah.
mindful.
Yeah. And even just from a more like a more everyday perspective too of like people with kids. My kids have shown up as energy vampires, right? It's again, it's not always this big scary thing. And I think, I'm always very cautious in how I talk to clients about it because I don't ever want them to be fearful of the metaphysical piece. I just want them to be informed so they can better understand how to protect themselves.
Yes. And you practice a technique that I really like, and it's called creative emotional wizardry. What
Mhm.
can you share on that?
So, creative emotional wizardry has a number of different aspects to it. There is more of an emotional aspect, there's the metaphysical aspect, there is also more of a physical when we talk about different viruses, bacteria, being able to use muscle testing to find the frequency of the viruses, the bacteria, the fungus, and then pulling that from the body. Um, when it comes to the metaphysical things, there's a number of different categories that can show up for people. So even like you mentioned, different energy vampires, a psychic attack, or like an evil eye. Um,
I really like
yeah,
the jellyfish. I think that's
yeah.
interesting.
Jellyfish, which is kind of like slime and shows up in all different scenarios, right? Like sometimes I have people that's getting like someone getting over a virus and they've got jellyfish related to that. Or again, back to that feeling of like instinctually, if you're not wanting to like hug someone, like maybe it's someone you would usually hug and you're like, I feel some sort of resistance to that today. Like maybe it's because there's something more like energetic with them that you're not wanting to like pick up on or take on.
Yeah. How has that shifted your practice?
Honestly, it's shifted it a lot. And now not all of my clients are super open and into and willing to do all of the CEW stuff. That being said, it can be so impactful. Um, I oftentimes will find that even there's one like a reconnection is what the category is, and a lot of times I'll see this in clients that are struggling really bad with depression, of they're disconnected from God, from source, and being able to help reconnect them, bringing that to their awareness. And then being able to have conversations about like, okay, what made you vulnerable to this disconnection from God, from your higher power? I'm always very respectful and mindful of clients' beliefs. And this is something that like crosses all of that, right? Like, yes, there might be different ways of speaking about it and different approaches or different words for some of these things, but ultimately, like, it is something that impacts everyone. We are energy. We are not immune to being impacted by other energy. And so I think it's something that can be so powerful, especially from that like mental, emotional perspective with, like I said, even just like the boundaries piece, like being more mindful of boundaries with other people, or if someone's draining your energy, or if you're surrounding yourself with by people that are directing negative energy towards you.
Yeah. I really like that rotting example. A rotting apple example. My goodness. Right. Well, like you have an apple that's rotten and then you put other apples there, all the other apples are going to rot as well. And our energy definitely impacts our realities. What experiences do you have with Reiki healing or shamanic Reiki healing and prayer?
Experienced Reiki. I'm not trained in Reiki and I don't use Reiki, but I've experienced it. And I think that, again, it can be so impactful for people, it can be so powerful. And there is some also really cool science behind it. So it's just fascinating, again, like the energy piece of like how that can impact someone's health or whatever it is that they might be struggling with. Um, and prayer, again, like very much, I take my client's lead and I'm willing to support them in whatever way feels best to them. I think it can be so powerful. I always joke about, we're told growing up, sticks and stones can break my bones, but words can never hurt me. And in reality, like words can be so powerful. Again, everything's energy, everything has a frequency. And so I think prayer can be a amazing tool for clients.
Thank you. And to your point, everything is in fact frequency. I think it's really important to be mindful around what you're surrounding yourself with. Animals have frequency, plants have frequency, objects have frequency as well, right? So cleaning up your environment does in fact matter for your life. Just because I have this burning desire, what can you mention on any science of Reiki that you're aware of?
There's a really good podcast episode on telepathy tapes that they did on energy healing and going over some of the research of it. But they've done even some like hospital studies, and I can't remember all the specifics, but there's a really neat episode on it.
Like I know that a lot of nurses do Reiki, and I think a lot of the research has been with that. There have been big differences, statistically significant differences in patient outcomes of those who receive Reiki in addition to treatment as usual versus just treatment as usual.
Yeah,
Yeah,
yeah.
thank you.
And I will say too, it's one of those things where I think sometimes Reiki is one of those that sometimes I feel like clients get spooked by. And even like the creative emotional wizardry, I think because of the name and some of the things that we're dealing with. And I think the most important thing with that is again, like work with someone that you feel comfortable with, right? Work with someone that you trust, that they're using the tool in a way that is meant to support your healing. If it's someone that you get negative vibes about or someone that you just don't feel comfortable with, trust that intuition and don't write off the whole technique because, there's some bad apples, right? It's like it's one of those things where I think the tool can be amazing and like you do have to be mindful of who you're seeing and who's treating you and how they're using those tools.
I wholeheartedly agree. That wraps us up for today. If you're interested in finding or working with Amber Bowers, I have worked with Amber on several occasions. She's a friend. She is a colleague that I very much esteem and hold in high regard. And I can attest to the rigor and efficacy of her work. And she is very well resourced. She's really good at doing research. She's really good at taking care of people. So, for anybody who's interested in working with her, you can find her on Facebook at Bowers Counseling and Wellness. Her Instagram is Bowers Counseling and Wellness. Her website is bowerscounselingandwellness.com. Thank you.